Hey everybody, good afternoon. My name is Dustin Strong. This is Strong in Health, and this is the end of our Ask Me Anything hours where we answer all of your questions. And I was supposed to be reminded to speak slower today because I've been told I go a little fast. We only have 15 minutes to answer your questions, but if you have any questions, you can go ahead and type them in. We'll see if we can get to them today. If not, info@strongonhealth is a great way to get these questions to us. We can answer them, anything related to your health, anything related to nutrition. We're here to make sure that we're giving you a different perspective and helping you be armed with knowledge that is going to help you go possibly beyond what the limits that somebody else has put on your health condition. Oftentimes people are accepting these limits based on nothing other than cultural authority, based on the fact that somebody told them there's nothing you can do about it. So there's always more you can do, and our hope here is to give you those steps that are going to get you closer to go beyond what the limits have been set for you for your health, so you can find new, greater levels to be healthier and happier all the time. Okay, today we're going to talk about inflammation. We've had a lot of questions about inflammation, dementia, and something called muscle testing. So we're going to talk about that. Now, I do have one thing I want to talk about real quick before we get started. Oftentimes I get a lot of people who will say that doing things health-wise in a healthy way is too expensive, or to go the natural route is too expensive. And here's the one thing I just want to throw out there for all of those people who say that. Do one thing for me if you can and you're not doing keto. Eat some beans every day. Eat a cup of beans every day for a couple of weeks and see what changes in your life happen. That is the cheapest, most affordable way to get magnesium, potassium, and fiber and a good source of protein in your diet. This is consistent with all of the blue zones. They eat a lot of beans as a cornerstone of their diets. So if you're struggling and you don't have a budget, do that first. If you have other things remaining after that, then we can talk, or you can send in those questions. But that is an easy way to rule out a lot of the basic things that most people are missing in their life anyway. So many times I will make that as a suggestion for people, and 2 weeks later they'll say, oh, okay, yeah, I don't have that problem anymore. It's amazing what happens when you give your body magnesium. There are so many people struggling with magnesium, and if that's the change agent, fantastic. There are also an insane amount of people not getting enough potassium in their life. So those two micronutrients coming into your life for solid 2 weeks can do awesome things for your life. So give it a try, okay? All right, so inflammation. We have a lot of people asking about dietary factors, inflammation, and what can you do? Because inflammation is related to so many conditions, and it's at the root cause, you would say. But my question is, what's causing the inflammation? So inflammation can also be associated with dementia. So 2 things. Number one, we have to look at those things that are inflammatory foods, and the primary suspects are going to be things that are overly processed, so refined sugars, carbohydrates. Those are definitely going to be pro-inflammatory. Trans fats, okay? Anything that says hydrogenated or partially hydrogenated is going to be a type of fat that is going to be pro-inflammatory. We want to make sure we're reducing inflammation by keeping those out of the picture. Now, a lot of times commercially raised meats and eggs even can be more inflammatory than organic and grass-fed. There's a big difference in how the animal processes that. So in fact, a commercially raised egg will be higher in your omega-6s, and an organically raised egg will be higher in your omega-3s. So it does matter. Sourcing does matter when it comes to that. And we should have a 1-to-1 ratio omega-3 to omega-6. Now, the standard American diet is about 20-to-1 omega-6 to omega-3, so we got all this inflammation coming in. Fats are a huge part of that. And so when we're looking about the anti-inflammatories, but I would rather say the resolution of inflammation. Your body wants to resolve it. It's inflaming something for a reason. It's doing that to resolve an issue, and we want to resolve that inflammation and help complete that. And healthy fats, omega-3s, are essential for reduction of inflammation. So we've been told forever that fats are the enemy. Stay away from fats. Fats are bad. Fat's going to make you fat. Forget all of that. That is misinformation. You have to have omega-3s. They are essential fatty acids, EFAs, meaning you have to get them from an external source. There is no such thing as an essential carbohydrate, but there are essential fats. Remember that, people. You have to have the fats in there, and it's super important for inflammation resolution, making sure you're getting in there. So healthy fats, let's talk about that. I use the acronym BACON all the time, so a good quality butter, not margarine. Margarine's going to be pro-inflammatory. Butter, avocados, coconuts, and coconut oil. Coconut oil is incredibly helpful for inflammation and also been known to be helpful in a lot of dementia type prevention studies. Olives and olive oil, nuts and seeds, my big favorite. Walnuts, of course, are going to be the highest in omega-3s, so keep the walnuts in there. And then good healthy fatty fish like salmon and cod are going to also give you some healthy fats. Okay, so remove those things that are pro-inflammatory, increase those things that are inflammatory resolutionary, I don't know, okay, so I got ahead of myself there. Anyway, that are going to help you with the resolution of the inflammation. That's what you want to do. So this kind of leads perfectly into dementia, because what we're talking about is reduction of risk. We want to remove all of those things that are going to increase your risk of incurring dementia and increase those things that are going to help reduce the risk of dementia. And healthy fats are essential for that. You have to have good healthy fats. That's why you're always going to hear things about coconut oil with the reduction of risk of that. There are so many things, and this is the most important thing that I want you to take away from dementia, is that there are so many things you can do to reduce your risk. There are tons of things that can be done for reduction of risk. We had a brain box for the Strong and Health box that came out last year, and we outlined a great book that was all about dementia prevention, and they had a whole acronym called NEURO, and it was about nutrition, exercise, unwinding, relaxing, I think it has to do with resting, and O is optimization. So there's all these things. We actually have our dementia box, our brain health box coming out again next month, and we've updated it with new information. So any of you out there who want to maximize the reduction of risk for dementia, this is what we're going to be talking about for you. So there's always things. So there's so much to talk about with this. I'm actually going to give you just part one today because there's so many things. So one thing I want you to think about when it comes to dementia is insulin. So actually, dementia has been referred to for a very long time as type 3 diabetes. So sugar, excess sugar, again, pro-inflammatory, is going to create all kinds of issues with that. But the actual problem, well, there's a lot of parts of it, but a bigger part of the problem is what it does to insulin resistance. When you become insulin resistant, that actually makes it harder for your brain to get the glucose. So insulin resistance does not just affect you as a diabetic, it also affects your brain. It affects so many things in your body. Remember, holistic approach and understanding this helps you understand that it isn't working just in a vacuum here, it's working for your whole body. So the more you can help increase your body's ability to utilize insulin, become less insulin resistant, the better you can be. And my one little takeaway for today for that is the best thing you can do is to incorporate a little bit of fasting. We have so many questions about fasting. And now, when somebody asked me about it today, they say, oh, how much do you want me to fast? And my answer is, well, as much as you can, really, and find a version of it that works for you. Remember this, 12 hours is a great starting point. Years ago, a couple years ago actually, they were talking about time-restricted feeding and how it was helping with so much with blood sugar levels and helping people who were diabetics. And that was just making sure you're eating within a 12-hour window. Now, we've learned since then that if you have an 18-hour fasting window, it actually helps with the insulin sensitivity even better. So see if you can start moving towards that. Personally, here's what I do. I eat my first meal at 10 o'clock during the week and my last meal at 4 o'clock. And you think, that's crazy, he's missing dinner. But it gives me an 18-hour window a couple of days a week. Don't do it all the time. Just do it as much as you can. Do it once or twice a week. That increases your body's ability to become it can utilize the sugars and the insulin a lot better when you do it that way. Fasting is incredibly powerful healing medicine, especially for brain health. Do a Google search on that, on autophagy and mental health. You're going to see all kinds of information come up there. So finding a way to work in a little bit of fasting into your life is one of the smartest things you can do to help regenerate and repair. So again, there's so many things you can do. That's just two of them. You know, when it comes to sugar, when it comes to fasting, those are going to be very, very helpful. And there's a lot you can do to regenerate and regrow your brain, believe it or not. Okay. Hope that was information that was helpful, guys. Thanks for watching. Keep those questions coming in. We really appreciate it. It helps us to keep having conversations and staying at the cutting edge of what information is coming out. We're going to keep some more information coming on dementia every time we go live this month, because the dementia risk reduction box is coming out next month, or the brain health box. So we'll have that for you guys next month, and we'll be answering questions Tuesdays and Thursdays the rest of the month. Take care.